Through this video, we will be talking to you about naloxone. And you, having that available in your home or on your person, can have you in that right place at the right time to save that individual from that potential overdose.
Your Walgreens pharmacist is a trusted source of information about preparing for and recognizing an opioid overdose, and can also help you use self-care and other non-opioid pain relievers to manage pain, to manage the most common opioid side effects, to safely store your medications when not in use, to dispose of opioids or other medications that are no longer needed, and to use all medications safely and effectively.
Understanding the signs and symptoms of an actual overdose is vitally important for the general population. When an individual has become non-responsive, when you can see that their face is turning an ashen gray, their lips are blue, fingernails are blue due to lack of oxygen, they're not responding when you shake them or rub knuckles on their sternum or right underneath their nose, which are normally very painful areas. When that person doesn't respond, it could be a potential overdose. When their breaths are less than 10 breaths per minute, or there's a gurgling sound, a very deep snoring sound, you may want to then consider and start to administer naloxone in order to wake that person up to rescue from that potential overdose. If in fact naloxone is not necessary, but you are going to administer it, there is no harm. It's more important to administer it just in case it could be the overdose, and we ask that you do that rather than decide and question whether it should or should not be given. As we talk to you today about naloxone, we want you to understand of the different types of individuals and their circumstances who may be at risk for a potential overdose. And we have found through our own studies that we have patients who have simply misused their correct medication. They either had more pain and took more meds that were necessary and capable for their body to handle, so that they slipped into an overdose mode. We know that in many locations, many communities, we have family and friends who share medication because of economic circumstances, distance circumstances, and we realize that what one good dose for pain relief for one person can actually be very detrimental and possible death to another. And then we have high incidences of accidental ingestion because of the number of medications that are in the home. We have recreational use now that includes, unfortunately, prescription medications for pain relieving, but also heroin and fentanyl-related products. And when that's part of the party scene or the recreational scene, somebody trying it for the first time can easily slip into an overdose. And then, of course, individuals with opioid use disorder, we find that those individuals in every population group are potentially at risk. So today, as we talk to you about naloxone, we want you to realize why it should be in your home, why you should have it among your friends and family and others because of the widespread utilization or mistakes that may occur from somebody with their medications.
Hold the Narcan nasal spray with your thumb on the bottom of the plunger and your first and middle fingers on either side of the nozzle. Do not press the plunger to test or prime the device. If you do, you will waste all or part of the dose of medication. Tilt the person's head back and provide support under the neck with your hand. Gently insert the tip of the nozzle into one nostril until your fingers on either side of the nozzle are against the person's nose. Press the plunger firmly to give the full dose of Narcan nasal spray. Remove the device from the nostril after giving the dose.
If you are ready to use, pull off red safety guard. To inject, place black end against outer thigh, then press firmly and hold in place for 5 seconds. 5, 4, 3, 2, 1. Injection complete. Seek emergency medical attention. This device has been used.
When someone is suffering from an overdose, you want to attempt to arouse them by rubbing the knuckles on their sternum. You want to check their breathing to ensure that they are at least more than 10 breaths per minute. If less, you want to look for your naloxone and administer it according to the appropriate device instructions. Upon administration, you want to place him in the recovery position and then make sure that 911 has been called to receive the appropriate treatment necessary for that person.
As the United States Surgeon General, it is my sworn duty to protect and improve the health of all American people. Right now, as opioid overdoses kill more people each year than car crashes, the first thing we need to do is stop the bleeding. Naloxone gives us the ability to save a life and the potential to get someone suffering from substance use disorder into treatment and on a path to a healthy, happy, and prosperous life. But again, first we've got to keep them alive. This advisory will hopefully serve as a nidus for important broader conversations about prevention, treatment, and recovery.
Being prepared to change a life is just as important as being prepared to save a life. You need to know the important next steps for that individual who has been rescued. Whatever services are necessary, whatever support is necessary, you need to be able to refer that person for those services.